In English, the question is whether it's better to gain weight after breast fat grafting or to maintain the current weight. In fact, there aren't many people who enjoy gaining weight, right? It seems that no one can say, gain 5 kg for your breasts. The person who has had the most procedures at our hospital has undergone it 6 times to achieve an F cup. Hello, I am Dr. Hong Jong-hyun from Fresh TV. What is today's topic?
It's breast fat grafting.
Breast fat grafting.
For breast fat grafting these days.
Absolutely. With summer approaching, many people want to undergo the procedure naturally and discreetly without their boyfriends knowing, and those who had it done in the past are also coming in through word of mouth. It seems that breast fat grafting at the hospital is still quite consistent.
Which areas are typically used to extract fat from breast fat grafting?
I believe that breast fat grafting can be done from any area with excess fat, but generally the areas that women most want to reduce are the abdomen, thighs, and outer thigh areas. Most procedures are performed on the abdomen or thighs.
But for those with a slim body type, they need to gather fat from somewhere to enhance their breasts, like from 2 arms worth, or fat below the buttocks.
Additionally, when extracting fat for the procedure, I often joke that I gather everything, even the soul. I really try to collect as much as possible and put it in, but there are some surgical challenges. However, because patients are so eager, I gather all the fat that can be collected. While performing breast fat grafting, I focus on certain areas to create cleavage or to fill in the upper breast if it appears hollow. However, achieving the same volume as silicone implants, which involves completely lifting the tissue, seems a bit excessive. For those who naturally have very little cleavage, we can gather it inward, but in the case of a new breast, the situation changes a bit. Since the center bone area of the breast is quite protruding and spread apart, bringing together such widely spaced breasts is not very easy. I think we need to look at the case first. It would be better to have a consultation.
If I have fat grafting and gain weight, will I gain weight there?
This is something I talk about every day. When you undergo fat grafting, the fat doesn't just dissolve like filler. If the number of cells was 50, it adds another 50, resulting in 100. It's not that the cells disappear, rather their size increases and decreases. Therefore, after the grafting, it seems that the area tends to become a bit more prominent as it gains some weight.
It is better to gain weight after breast fat grafting. There are many opinions about whether it's better to maintain the current weight or to gain weight, but would it be better to do it this way?
In fact, there isn't anyone who likes to remove fat. If I happen to have localized obesity, with my legs being a bit plump, I would want to shape my legs nicely while the rest of my body has no excess fat. While gaining weight may not seem burdensome, it seems that no one can really say to gain 5 kilograms just for the breasts. What I suggest is to try to gain just about 1 kilogram, even if it's just a little, as it appears to have a much better effect on the survival of the breasts and the rest of the graft. Is there a method from the doctor to increase the survival rate, perhaps by maintaining or gaining 1 kilo? That's a secret. In my case, I use a specialized device called Harvest Jet, but my approach to extracting fat for large volume fat grafting is a bit different. The know-how to improve the survival rate without side effects varies among each doctor, but I also have my own methods. To summarize briefly, while stem cells are often said to have a good survival rate, that doesn't quite align with the reality. Stem cells refer to cells that are in the stage before differentiating into fat cells. To put it simply, if we think of an egg that grows into a chicken, we should consider the egg before it becomes a chicken. The mature cells are first implanted, and then these egg-like cells, which are not yet fully mature, are placed in the grafted area. Over time, these cells hatch and become fat cells. It's fascinating. Stem cells are not used to immediately improve the survival rate, but rather as a method to increase the number of cells over time. Stem cells, as the name suggests, require expensive equipment and specialized techniques for extraction and implantation. Therefore, while the effects are certainly good in the long run, they are not directly related to the immediate survival rate. Scientifically speaking, that's how it is. So, does the surgery take longer when using stem cells? It takes about 50 minutes to operate the equipment, and preparing and other tasks may take an additional hour, but it can often be done simultaneously during the surgery. So, when I usually perform breast fat grafting, it takes about an hour and a half. However, if we prepare quickly in advance, it seems to take roughly 30 minutes longer than the usual time.
Most people recognize it as the first and fifth stages. Is it possible to do more?
Is it really possible to reduce the volume from F cup to C cup after 6 procedures at our hospital? Yes, it is possible. As long as there is fat and materials available, you can keep adding more. Of course, it would be great to create an F cup all at once, But thinking of it as my own natural fat, I keep adding it little by little. 1 cup, 1.5 cups, and so on, until I'm satisfied. So as long as there is fat, people come in, get it extracted, and it seems like they take almost all of it from their bodies to put it all into their breasts. That's why that person with the F cup is amazing.
Response in direct flights in Detroit.
Of course.
It doesn't seem like the blood washing and age restrictions are indeed applicable.
I don't think it's right to have age restrictions based on the condition of the breasts or the amount of fat available for extraction.
What was the age of the oldest person who came in for breast fat grafting surgery?
I can't remember exactly how old I was, but there were definitely people in their 60s. So, looking at this, I realized that women's desire for beauty surpasses age, now has everything you were curious about been resolved. Today, I talked about breast fat grafting, which I was curious about. If you have more questions or anything else you'd like to ask, please leave a comment below or contact our hospital and we will kindly respond. That's it for today's video. This is Dr. Hong. Goodbye.